Hello everyone, today we're going to be going over the NICE guidelines for hypertension management. So just for some quick reference, please have a look at this diagram. Whatever you need, annotate it, screenshot it, or have a go at drawing it, whatever it takes for you to help to understand it, please have a go at looking at this. Okay, let's have a go at question 1. So just an exam tip for you, always read the question and the answer stems first before looking at the stem of the question so that you know what you're looking out for when you read the question stem. So for this is asking for the initial step in the management of the patient's hypertension. So from that, the question options being modified release metformin, indapamide, insulin, amlodipine, and lisinopril. So from that, we can already rule out A and C because modified release metformin and insulin are used to treat type 2 and type 1 diabetes mellitus. And the question is asking for hypertension management, so we would rule out A and C. Now let's go to the question stem. So it's a 56-year-old male from Jamaica. He's come in for a hypertension review clinic. His last readings was 138/90, so quite high. It's now risen even more to 145/92 despite interventions. He's currently on a calcium channel blocker, amlodipine, but he's not responding well to treatment. So going back to the guidelines, the first step would be to see whether this patient has or does not have type 2 diabetes. So from the question stem, it shows that he doesn't have type 2 diabetes mellitus, so we're looking at the pathway on the right. He's also of Afro-Caribbean descent and over 55 years old. So the first step would be to give him a calcium channel blocker. He's already on amlodipine, but he's not responding well. So the second thing to do would be give him an ACE inhibitor or an angiotensin 2 receptor blocker. There's no examples of angiotensin 2 blockers here, so no examples of candesartan or losartan, and the only ACE inhibitor I see here is E, lisinopril, so the answer will be E. Now let's go to question 2. Okay, so again, exam tip, always read the question and the answer stems first before looking at the keywords from the question stem to figure out your answer. So A, so this patient feels that the medication has had little effect, so whatever medication she's on isn't working, she's worrying about it may impact on her other health conditions. What would be the most appropriate next step in the management of the patient? So the next step meaning after what she's already being given. So nifedipine, which is a calcium channel blocker, lifestyle modification, which is quit smoking cessation, lisinopril, so ACE inhibitor, spironolactone, and atenolol or beta blocker. Okay, so this is a question of a 55-year-old female who comes into GP surgery. She's a smoker, has recently been diagnosed with type 2 diabetes mellitus, and has a past medical history of various cardiovascular conditions, an MI, atrial fibrillation, and hypertension, for which she's on the SGLT2 inhibitor, she's on losartan, which is an angiotensin 2 receptor blocker, and she's on an ACE inhibitor. So from her blood pressure readings, we've seen that her hypertension is poorly managed. Cool. So the first thing we would do is identify does she have type 2 diabetes mellitus or she doesn't. So this patient does have type 2 diabetes mellitus. So the first step initially would be to give her on an ACE inhibitor or an angiotensin 2 receptor blocker. She's already on ramipril and she's already on losartan, and this isn't working. Okay. The second step would be to put her on a calcium channel blocker or a thiazide-like diuretic. And the options here does have A, nifedipine, which is a angiotensin 2 receptor blocker. Why would it not be the other options? So she's already put on drugs, so she's beyond lifestyle modification at this point, so it wouldn't be B. Lisinopril. You wouldn't want to give her lisinopril because she's already on an ACE inhibitor and it's not helping her being managed. Spironolactone is way after, once you've given the ARBs, the ACE inhibitors, the cyanide-like diuretics and the calcium channel blockers, and then you would give a low-dose spironolactone if her potassium was less than 4.5. And atenolone, again, even after giving a low-dose spironolactone, you would give a beta blocker if her potassium was over 4.5. So the answer is A, nifedipine, the angiotensin II receptor blocker. Thank you.